All right, so Robert Jacobson is a primary care pediatrician at the Mayo Clinic in Rochester, Minnesota. He is the medical director of the immunization programs for both adults and children for the primary care practices in Rochester, as well as Southeast Minnesota Mayo Clinic Health System. He's also the medical director for the Population Health Sciences program at Mayo Clinic and conducts research investigating how to improve vaccine coverage. He teaches the principles and practices of pediatric research as well as evidence-based medicine to pediatricians in training. He lectures widely on topics concerning vaccines. And the Great Lakes Intertribal Epidemiology Center is fortunate to be working with Dr. Jacobson to provide additional information on vaccinations, and infectious disease control to the communities that we serve. All right, so I will hand it over to you, Dr. Jacobson.
See there. Thank you, and thank you very much for having me. I am delighted to speak on this topic. It's an important one, vaccine catch-up. Frankly, we spend a lot of time doing vaccine catch-up in our work with children and adults. I have a number of learning objectives for us for this presentation that at the end you'd be able to list the main principles of vaccine catch-up, that you'd be able to describe the practical steps of how you go about in the office conducting vaccine catch-up. Then we'll talk briefly about using the case approach to vaccine hesitancy often encountered when you attempt vaccine catch-up. Now, the first principle of vaccine catch-up is this. You got to know this, you got to just accept it. Catch-up is complicated. There are minimum intervals between doses. So a person might be behind in 3 doses of DTaP. You just can't plan to do them over the next 3 days. There are spaces that you're going to have to honor. There are minimum ages for a number of our vaccines. And then for one vaccine, there's a maximum age. But there's also maximum ages for some of the catch-up for some of the vaccines. So it's not just rotavirus that maxes out, but Haemophilus influenza, pneumococcal conjugate vaccine, and others. There's also real complication with the number of required doses. A person may be delayed for years only to find that when they originally would have had 4 doses to give them coverage during the years they were behind, they only need 1 dose now for catch-up based on how old they are right now. That doesn't solve the problem that they were under-vaccinated for the last 2 years, but at their given age, 1 dose might work, whereas previously in infancy, 4 doses were required looking ahead. None of the vaccine series that we're talking about for routine vaccination for children or adults needs to be restarted if there's a long period of time. That's part of the complication of catch-up. Sometimes it'd be just easier to say, well, let's just start over. Instead, no, it's complicated. We need to look at the catch-up schedule. Some series are abbreviated by the child's age, as I had mentioned, and the child at a certain age may need less vaccines than they would have done the year before. In practice, and I can't stress this enough, you got to go to the printed catch-up schedule. I don't think there's any good way to memorize the catch-up schedule. You go to www.cdc.gov/vaccines. Always remember to put the S after vaccine. Don't try immunization or immunizations. It's www.cdc.gov/vaccines. When you get that, you'll find the child and adolescent immunization schedule. If you click on the child and adolescent immunization schedule, you'll get the catch-up schedules as well. I really ask my staff to never rely on memory. Use the appropriate age chart for catch-up. If your child is between the ages of 4 months and 6 years, you use that chart. If your child is 7 years and older, you use that other chart. There's even a catch-up schedule for adult vaccines as well. It's really important if you find yourself really puzzled, double check and make sure you have the age of your child correct and use the right schedule. Now, This year, the CDC changed the chart, and what I'm calling footnotes are actually now just circles with the letter I in the middle. But when you click there, you go down to where traditionally footnotes would be found at the bottom of the schedule, and there's more information in the footnotes about the vaccine. And you really need to read the footnotes as well as look at the schedule to see what doses you'll need to give. Okay, if the first principle is that vaccine catch-up is complicated and you got to use the written schedule, the second principle is give all the vaccines that are due today. Consider 6 arguments for this principle. First of all, the vaccines are just as safe. The vaccines are just as safe when given together as when given apart. There's no exceptions to this. The vaccines are just as effective when given together. There is the rare exception. I can think of Menactra brand meningococcal ACWY combined with Prevnar PCV13. Those can't be given on the same date to a child because of interactions. We actually at Mayo Clinic also practice the same rule for adults who need both vaccines. You can use an alternative brand for Menactra. You can use the Menveo brand and give it with the Prevnar, or you can delay the Menactra brand until the patient has completed the Prevnar. So one solution is to give the Menveo, meningococcal ACWY, and the Prevnar, or give the Prevnar PCV13 and wait 2 months, then give the Menactra. Vaccines given at once on one day are less painful. Studies show that it's more painful to get vaccines on separate days. It's less painful to get them all at once. These studies have been done in babies and in toddlers. I think it applies to older children and adults as well. There's a part of the pain is that anxious waiting and anticipatory pain. Getting them all done at once, it's like pulling off a bandage fast. It hurts, but it hurts for that moment, and then it's gone. Less anticipation, less apprehension, less fear. You are not doing your patient any favor by saying, we'll give these over 3 days when you could give them all today. Another part of that second principle is giving vaccines due is less confusing. When the schedule calls for more and not all are given, it raises doubts in those reviewing the records as to whether those other vaccines are still due, and it often leads to needed vaccines being missed. As a medical director of an immunization program, I can tell you I frequently see this problem when either the parent has proposed some alternative schedule or the provider is held back in giving all the doses due. It often results in even further delays when the patient comes back because of a misunderstanding of what the schedule is. Picking ones to give is problematic. Let's say 3 vaccines are due. All are needed. Epidemiologically, the child is at risk for all the diseases. Once you're behind, you're at risk for that disease. Asking the healthcare professional to pick one of the vaccines to give is equivalent to asking that person to decide which of the children get to ride in the one car seat home and which children go unbuckled and at risk. I won't do this for a parent who says, just pick one of the vaccines. I say they're all needed. I want your child to get all of them today. If you're not going to go with all of them, you're just going to have to pick. I can't tell you one is more needed than the other. They're all needed. The ones left behind are likely to suffer. Parents are notorious for failure to follow up in time. Only 30% of children actually who are due a second flu vaccine, that is because it's their first dose, they're less than 9 years of age, actually get it during that season. And when parents pick alternative schedules, studies have shown only 9% of parents actually stick to that even alternative schedule. They get behind. Principle 3, make a strong recommendation. So I've told you about 2 other principles. Vaccine catch-up is complicated, use a chart. Principle 2, give all the vaccines due now today. And principle 3 is make a strong recommendation. Use presumptive language. Your child is due for 6 vaccines today: the DTaP IPV Hib, the PCV13, the Hep B, the MMR, the varicella, and the Hep A. The next visit will take place 1 month from now. Those sentences you're seeing on that slide are using what we call presumptive language. You're saying what's due, what's needed. You're being matter of fact. You're answering the implied question, what do we need to do? This is what we need to do. You can then ask, do you have any questions for me? And if the parent has questions or the patient has questions, they can then ask, but you've made it clear what's due. Asking for an opinion sends the wrong message. Take a look at that second bullet. What if instead of using presumptive language, you said, what are your thoughts about getting the DTaP IPV HIB, the PCV 13, the Hep B, the MMR, the varicella, and the Hep A all today? What are your thoughts about that? That sends the wrong message, like these are options and choices. It implies that the choices are reasonable. Follow-up is critical too. Note the strong recommendation included a follow-up plan for continued vaccination. Setting a date for the next round of shots is key. Don't leave it to chance. Don't leave it to the appointment desk. Make it clear in the parent or patient's mind when they're due back. Don't be shy. Principle 1, vaccine catch-up is complicated. Use a schedule. Principle 2, give all the vaccines that are due today. Principle 3, make a strong recommendation. Principle 4 is deal with hesitation. When you ask for questions and the parent says, isn't that a lot of vaccines to give all at once? You should deal with the hesitation in the moment. I recommend you use the case approach. The C stands for corroborate. Identify the specific concern, find the common ground. When that parent said, aren't those vaccines too much? You don't know if the parent means, isn't that going to be too painful? Or is that going to overwhelm the child's immune system? You need to identify the specific concern so you can address it. And you got to find the common ground that you have between you and the parent. Once you've figured out what it specifically the parent is concerned about, you can then address it. And then you do, in the case approach, the A step, which is about me. You identify how you address that concern. Let's say the parent said, won't that hurt too much to get all 6 at once? And then you say, you know, as a parent and as a provider, I was worried about that too, until I did my readings as your child's vaccinator to find out that it's actually more painful to spread out the 6 injections over 6 different visits. We'll have less pain if we give it all now. That's the science. You've summarized the science. That's the S in case. And then you move to explain your advice. So actually, to reduce pain, I'm recommending that we give all 6 doses now. There you've explained the advice in terms of the parent's concern, the common ground of wanting to minimize that pain, and the science. So in summary, you should be able now to list the main principles of vaccine catch-up. Catch-up is complicated. Use the written schedule. Give all the vaccines that are due. Make a strong recommendation and deal with hesitation using the case approach. You should be able to describe the practical steps of how you go about vaccinating with catch-up. You pull out the written schedule, you figure out based on that child's age which table you use, and you figure out which vaccines are due today and when the child comes back next. You use the charts, you use presumptive language, you identify all the vaccines due today and the plans for follow-up. Use a case approach with any hesitation.